Hello, and welcome to the Current Science and Technology podcast from the Museum of Science in Boston. I'm your host, Susan Heilman, and every week we bring you interviews with guest researchers and our museum staff covering science and technology in depth. The sooner you can identify an infection, the sooner you can treat it, and the sooner you can get better. Makes sense, right? But sometimes it can take days to detect a potentially fatal infection. The museum's Karine Thate is here to talk about a new technology that may detect infections in a few short hours. Hi, Karine.
Hi, Susan.
So what exactly is this new detection system? I mean, certain bacteria or fungi only grow at a certain rate.
This new detection system is created by T2 Biosystems. It's a local startup company here in Massachusetts, and they've developed this device that uses iron oxide nanoparticles to detect infectious agents. And the way this device works is they can take a blood sample or a urine sample or saliva sample from a patient, and they add these tiny particles of iron, these iron oxide nanoparticles, and these particles have been tailored to bind to certain infectious agents. In other words, these iron nanoparticles can recognize and attach to certain bacteria, viruses, or fungi.
So they have little teensy things sticking off of the nanoparticles that only bind to whatever infectious agent they're looking for?
Exactly. These particles are very specific. They're able to recognize exactly the infectious agent they're looking for. They attach to it. And then what you do with this blood sample is you put it into a device. This device is about the size of a printer. And this cartridge fits into the device, and then a magnetic field is applied to it. It's basically a small, simplified version of an NMR, or a nuclear magnetic resonance imaging system. And once this magnetic field is applied, it acts on the iron oxide nanoparticles, and they're able to determine whether this infectious agent is present in the blood and also how much of it is present.
Because the iron nanoparticles are magnetic, they'll respond to the magnetic field.
Exactly.
So how do we normally recognize infectious agents now? This sounds pretty simple and therefore very quickly. Why can't we do other tests just as quickly?
Well, normally with conventional lab methods, for certain things you're trying to recognize, bacteria or fungi, you need to actually grow them in a lab. So you have to take a sample of a patient's blood, for example, and then you have to kind of extract what you're looking for, purify it, and then grow it in a lab. And that can take days with some slower growing organisms. But in this case, you don't have to go through those extra steps. You can just take the sample, add in the nanoparticles, and right away it can identify even very small levels of it in the blood, and you can identify the infection without having to take all those extra steps.
So it's a much more sensitive process. It can work with very, very little of the infectious agent.
Exactly. So the magnetic detection system is very sensitive, and the magnetic fields are able to act on even small amounts of these iron nanoparticles, and we can identify even very small amounts of the infectious agent in a sample.
So we keep saying infectious agent as a general term, but they must have tested this initially on a particular type of infection. So what were they looking at in order to create this machine?
Well, right now this machine is able to detect Candida, which is a pretty serious fungal infection, or it's a fungus that's one of the most common hospital-acquired infections, and it's actually the most deadly of them. Every year, about 60,000 patients acquire candidemia, which is when you get Candida fungus present in your blood, and 40% of patients die from this because it takes so long to diagnose. If you're able to identify this within the first 12 hours, you're able to cut that mortality down from 40% all the way down to 11%. So this is one very serious disease where if you can diagnose it properly very quickly, you can get patients the appropriate treatment and you have much higher survival rates.
Well, when they see a patient start to show signs of a disease, why can't they just start treating it with whatever they use to treat Candida and reduce the mortality that way? Why wait for the diagnosis if it could be fatal?
Well, candidemia usually affects patients that have compromised immune systems, are pretty sick already. They might be undergoing chemotherapy or have recently undergone a transplant. And when it presents, these patients just seem pretty sick, and they have an idea it's a blood infection, but they don't know what's causing it. So while they're diagnosing which specific infection it is, they usually put the patient on some kind of broad spectrum antibiotic. The problem is that when you give a patient with Candida this type of treatment, it actually causes a lot of complications because Candida is a fungus, not a bacteria. So it doesn't respond to that kind of broad spectrum antibiotic, and it actually can really make them more sick. So diagnosing exactly what these patients have is really critical to getting them the right kind of treatment. So T2 Biosystems focused on Candida as the first infectious agent for this device to recognize because they saw it as a really big need in hospitals to be able to diagnose this particular infection very quickly.
Right, because it's so prevalent and so fatal in so many hospitals.
Exactly, and the quicker you can treat it, you can save a lot of lives, you can save a lot of healthcare costs and a lot of time.
And when can we actually start to see this being used on a regular basis in hospitals?
They're about to start tests with actual patient blood samples pretty soon, and they're hoping to get FDA approval next year. So the device should be on the market in next year in 2012.
Great, that's pretty fast then, and I guess because this isn't actually invasive, you take the sample out of the patient first, then add the nanoparticles to it, then run it through this machine, so you don't have to worry about putting stuff into a patient in this
Exactly.
case.
Devices can go through that FDA process a lot more easily than, for example, drugs or anything that enters a patient's body.
So Candida being the first target for this machine seems very obvious. How difficult will it be to adapt it to looking for other types of infectious agents?
It shouldn't be very difficult. This process should work with a wide variety of infectious agents. The only thing you need to do is tailor your iron nanoparticle to recognize and bind to other bacteria, viruses, cancer cells, and they've shown that it's able to do that. So this will be a very adaptable test that could try to identify any number of infections.
Great. Well, this sounds incredibly promising, and hopefully, within the next year or so, we'll be able to see how well this machine actually works, and we'll hopefully start seeing a decrease in the number of Candida fatalities in hospitals because of this early detection system. So thanks for sharing this new technology with us, Karine.
My pleasure. Thanks, Susan.
That's it for this week's show, but be sure to come back next time for more of the latest in science and technology. This podcast is a production of Current Science and Technology at the Museum of Science in Boston, part of the Boston community for over 175 years. For more information, visit our website at www.mos.org/CST or email us at podcast@mos.org. Thanks for listening.